Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the gross anatomy of the appendix. The appendix is a tubular extension from the cecum. It is about 2 cm below the ileocecal junction. So this is a tubular diverticulum or extension from the cecum about 2 cm below the ileocecal junction. Okay, so this is the ileocecal junction here. From here around 2 cm below, this is the appendix. This is the appendix. This is the ileocecal junction. This is the ileum, terminal part of the ileum. This is the cecum. So about 2 cm from here, this is the appendix. It is also called vermiform appendix. It is located in the right iliac fossa. Located in the right iliac fossa of the abdomen. Okay, so you got the location. Position is important to us. Position. The appendix has multiple position like that of retrocecal. That is very common. Then second common is pelvic. Then paracolic, and we'll get the pre-ileal, post-ileal, sacral, and subcecal. Okay, like that of a clock here. Okay, so if it goes this way, okay, if you look at the tip, this is the base, this is the body, this is the tip, this is the paracolic position, paracolic. So if you go there, 11 o'clock position here is 11 o'clock, and then we go to the 12 o'clock position or retrocecal. Okay, this is retrocecal. The tip is around 12 o'clock position. 12 o'clock position. Then we'll get the splenic position. These two, pre-ileal, post-ileal, together is called splenic, because it is our spleen is in the left hypochondriac region. So here around 2 o'clock position, it may be pre-ileal, just in front of the ileum. It may be post-ileal. It is also possible. Okay, so base is fixed, tip and the body are moving according to the position. So it may be pelvic, like this is the pelvic here, and it may be subcecal, 6 o'clock position. So 2 o'clock here, that is the splenic. Then we have the 4 o'clock position, that is the pelvic. We have another one that is called sacral or 3 o'clock position. This is 3 o'clock position. This will be like that, critical towards the sacral promontory. This is the sacral. This is sacral. This is pelvic. These are splenic position. This is the retrocecal, that is very common, around 70% or 65%. Pelvic is around 30%. Others are those percent, and that is subcecal. So these are the position. Base is fixed, but the position of the tip and the body is different. Okay, most common is retrocecal. We got the position of the appendix. Okay, it's very important to know the position, because the retrocecal part is behind the cecum. It may not irritate the parietal peritoneum even in case of acute appendicitis. Okay, but the vermiform appendix has a mesentery, so it is intraperitoneal structure. So the appendix has a mesentery. So appendix is an intraperitoneal structure. Is an intraperitoneal structure. Okay, good to know that part. And this is the mesentery, this dark spot. This is the major appendix. The appendix, the mesentery of the appendix is the major appendix. This is going posterior to the ileum, and it is attached to the posterior layer of the mesentery. This mesentery, and this mesentery carries the blood vessel, the appendicular artery. This is the appendicular artery. Okay, we got that. So we got that, and we got appendicular artery, branch of ileocolic artery. This is the ileocolic artery. Ileocolic artery is a branch of superior mesenteric artery. This is superior mesenteric artery. Okay, that is a branch of the abdominal aorta, one of the ventral branches of the abdominal aorta. So we got the mesentery, content of the mesentery. Mesentery also contains some lymph node. Okay, and these are branched out here. Usually tip is lacking less blood supply, this part getting more blood supply. Okay, so what is the length of the appendix? Length is very much variable. Length is around 2 centimeter to 20 centimeter. On average, it is 9 centimeter. Okay, what is the diameter of the appendix? It varies from person to person. Okay, diameter in children has more lymphoid tissue. In case of adult, the lumen may be obliterated as a whole lymphoid tissue is atrophied. Diameter is around 0.5 millimeter, depending on the physique, and individual variation is always present. Okay, we got that. The appendix is open inside the cecum by the appendicular orifice. Appendicular orifice is here, is appendicular orifice. Okay, appendicular orifice. What is the location in our body? Location, the junction between right lateral plane and the transtubercular plane. Okay, this is the right lateral plane. This is the transtubercular plane. Transtubercular tubercular plane, okay, and their junction is here around 2 cm below the junction of the right lateral plane, and the transtubercular plane, this is location of the base of the appendix. This is for the base of the appendix. That means this part is here, okay. And we have to know one more point, very important, especially for diagnosis of appendicitis. One point is called Mcbarney's point. Mcbarney's point. This is the point on the spino-umbilical line from the anterior suprailiac spine to the umbilicus. This is the anterior suprailiac spine to the umbilicus. So, at the junction between the lateral 1/3 and medial 2/3 of the spino, that is for anterior suprailiac spine, umbilical line. This is the umbilicus, this is the spine, anterior superior iliac spine, okay, anterior superior spine. This is the umbilicus, and this is the inguinal ligament, pubic tubercle, will not go there, okay. So we got the position, base, body, tip, and how the opening is guarded. The appendicular opening may be guarded by a mucosal fold. It may present, may not present. So appendicular orifice may be guarded by a semilunar mucosal fold called valve of Garlock. Okay, we got the opening, we got the blood supply from the ileocolic artery. We have also colic artery, anterior colic artery, posterior colic artery. This is the appendicular artery. This is the appendicular artery. This is the appendicular artery. One of the branch of the appendicular artery may anastomose, usually anastomose with the posterior colic artery. So appendicular artery is not exactly an end artery because it has anastomosis with the posterior colic artery. There is also a branch of ileocolic artery. Okay, we got the blood supply. Now we go to the venous drainage. We got the arterial supply. Venous drainage by means of ileocolic artery that will ultimately go to the superior mesenteric. The venous drainage will go through the ileocolic vein, then it will go to the superior mesenteric vein, then it will go to the portal vein. So we go to the venous drainage of the appendix. We go to the ileocolic vein, that will go to the superior mesenteric vein, that will go to the portal vein. Okay, we got the venous drainage. Then we'll go to the lymphatic drainage. Okay, lymphatic drainage of the appendix will go to the ileocolic lymph node. and also it will go to the, some of them may go to the appendicular lymph node. Okay, we got that. Now we'll go to the nerve supply. Okay, so ileocholic lymph node and the appendicular lymph node nodes, multiple, we may have multiple. Then we'll go to the nerve supply. Nerve supply. Nerve supply, we have sympathetic from T10, parasympathetic from vagus, sympathetic from vagus nerve. So sympathetic is very much important to us. Both of them are important. Sympathetic actually carry the pain sensation. So the sympathetic going to the spinal cord in the posterior gray horn area, from umbilical area, we have dermatome is T10 around the umbilicus. So this sympathetic fiber and the umbilical region somatic fiber will mingle in the posterior gray horn, that will go to the brain, and brain may interpret pain may come from the umbilicus. That is called referred pain to the umbilicus because of same segment umbilicus. We have the dermatome T10 and appendix is getting sympathetic innervation from T10. Okay, these are coming from inferior mesenteric plexus. Mesenteric plexus. Okay, we got the nerve supply and referred pain to the, but after a few hours this pain from the umbilicus will settle mostly on the Mcbarney's point. This is the Mcbarney's point we discussed, the spino-umbilical line, junction between lateral 1/3 and medial 2/3, Mcbarney's point. This is the site of maximum tenderness in case of appendicitis. It's closely related to the base. Okay, we got the Mcbarney's point, blood supply, nerve supply, lymphatic. Now a little bit histology, will not go there. Just remember that the umbilicus, to remember that the Baroniform appendix has rich lymphatic nodule in the submucosa. That's why the Baroniform appendix or appendix is also called the tonsil of the abdomen. That's all about the appendix. If you like my video, please subscribe me. If you have any question, please ask me and share the information with your friends. Have a nice day. Bye now.